Hello everyone, my name is Colin Graham. I'm currently an EMT for J&K Romney Rescue. I'm currently participating in Pierpont's Friday paramedic program. Today I'm going to walk you through the steps of a secondary assessment / history taking from the standards of National Registry of Paramedics and EMTs. We're going to start off with history taking, or our OPQRST. For O, or onset, we're going to ask, when did your symptoms begin? P, or provocation, does anything make it better or worse? Quality, is it a sharp, constant pain, or does it come and does it go? Does the pain radiate to any other areas? For example, does the chest pain radiate into the left arm? You're then going to rate your severity on a scale of 1 to 10, with 10 being the worst pain of your life. Time, how long have you had your symptoms? We're then going to move on to sample. We're going to gather the signs and symptoms from our patient, such as nausea and dizziness. We're then going to ask for allergies. Do they have any allergies to medications or food? We're then going to gather the medications. What are you prescribed? See if they have a list. We're then going to ask their pertinent past medical history. Do they have a history of cardiac issues, diabetes, etc.? When was the last time they ate? We're then going to ask the events. What were you doing leading up to your illness / injury? We are then going to add her to sample. H. Where are you going to? We are going to ask any habits of our patients. Do they smoke or any other bad habits that they may be a factor to our patient care? We're going to assess the environment. Is there any pollution? We're going to ask any risk factors. Does their family have a history of heart disease? After we gather our history, it is time to start our secondary assessment. We start by assessing lung sounds. Make sure you do all 6 locations, right to left, upper, middle, and lower lobes. Assess heart sounds. 2nd intercostal space, right and left of the sternum, and 5th intercostal space, midline clavicular. We're then going to assess their nervous system, especially in head trauma or possible CVA cases. Start with asking them to smell something of your choice. 2nd, have them read your name tag on your shirt and have them tell you when they see your hands enter their line of vision. You're then going to hold their chin still and have them follow your finger while you make an H. Then you're going to run your fingers across their face and have them say when they feel it. We're then going to play Simon Says. Have them wrinkle their forehead, smile, frown, and speak a phrase. Test their hearing by rubbing your fingers together beside their ears and telling which side you are rubbing on. Have them swallow and then gently make them gag. Lastly, have them turn their head to each side and shrug their shoulders. Look for any discrepancies. That completes your nervous system's test. You're then going to assess to see if they have any JVD. You're going to reassess their vital pulses, rate rhythm and quality, and have the patient squeeze your hands. You're then going to make sure pedal pulses are present, along with feeling the feet to assess to make sure they can feel their feet and assess for pedal edema. Once the minimum assessment is done, you will then go into your more detailed exam based on the body system affected. Once your physical assessment is finished, it's time to get vital signs. You must get all vitals to get a clear view of your patient. You should get a blood pressure, a pulse, rate, rhythm, and quality, an SpO2, a CO2, glucose, respirations, rate, rhythm, and quality, skin, tone, texture, and temperature, a temperature on your patient, level of consciousness, and lastly, pupils for reactiveness. Once you have a full view of your patient, after your assessment, history taking, and vitals, you can now make a better impression of your patient's condition and make a treatment plan. Does this patient need an IV, a 4-lead, medications, etc.? Then reevaluate your transport destination to make sure it is still appropriate for your patient. Remember to reassess your patient every 5 minutes for critical patients and 15 for non-critical. Thank you for listening.